in the country, they believe the husband has the right to beat the wife. They believe domestic violence is justified. It doesn't mean they are able to tolerate it and live the consequences. They do actually have physical and mental consequences that they have to deal with. And one of the consequences here is that we have a problem with the reporting of domestic violence. If you have all of this number of women who believe domestic violence is okay, is acceptable, then you do have a problem with even the very mere fact that domestic violence is not reported. And it means it's not even addressed. The lower graph shows men within the same age groups who believe the same thing. But what is very serious is to look at the women. This is very important, and it's very important for policy makers in the domain of public health. So these are two examples I wanted to share with you, showing that there are good sources of information in the Maldives for extracting information for public health advocacy. Now, let me come to a few recommendations that I would like to share with you very briefly. There are some areas where strengthening evidence for public health advocacy and public health policy change is needed. I would say there is information, there is evidence, but the evidence is still not strong enough to compel policymakers to come up with the right decisions. Some of these areas, if we look at mental health in general, it's an area where there is little scientific research that we can actually use to generate evidence for policy change. The impact of child sexual abuse on mental and health throughout the life cycle is an area which is understudied, and we really need a lot of effort from those who are concerned to generate more evidence for policy making, policy change in this field. The ability of the medical care or medical health system to handle evidence of child sexual abuse is quite limited. And by the way, this is one of the reasons, it's not the only, but one of the reasons that most of the sexual abuse cases of children are dismissed at the level of police investigation or even at the prosecutor general level because of the weak evidence. And this is an issue which is very important, is very much related to public health. It's related to the mental and physical well-being of children throughout their life. The fourth area is the impact of bullying on young people's mental health. For us in UNICEF, together with a number of partners in the Ministry of Education, Ministry of Gender, we have been consulting with various groups of young boys and girls in Mali and outside Mali. And this has been coming again and again and again, coming up as an issue that is impacting the mental well-being of young people. And for many young people, it has gone too far to the extent of creating ideas, and not only ideas, even sometimes action related to suicide or self-harm. So this is something which is very important to study and create more evidence that will probably create the interest on the part of policymakers. The impact of drugs use and gang violence on young people's physical and mental health is also an area which doesn't have up-to-date information. Very little information that is there. I'm very happy that mental health is being now taken up as a priority for the government, but one of the things that I noticed yesterday when we were looking at the public health expenditure, the expenditure at the moment on mental health is very limited. And I think it's very limited because of a number of reasons. One of the reasons that it is limited because as of now, we do not understand fully the scale of mental health problems, especially among young people. And at the same time, one of the challenges that we need is to invest more and more in preventing mental health problems, which I believe if you look at the current level of investment in drug prevention is not up to the mark. The last point that I want to mention here as an area where we will benefit more from evidence and sources of evidence is studying and investigating the cost of inaction to address the up-mentioned or all these issues, especially what will be the cost, economic cost, social cost, health well-being cost, in terms of not addressing issues like domestic violence or issues of mental health or violence or sexual abuse of children. This is another set of recommendations with regard to creating systems that will help the Maldives in dealing with evidence for public health and public health policy changes. The first one is it will be very helpful if the country can establish a national center for medical and social research. It's already included in the SAP, but I believe it is very important to expedite the creation of such kind of a center. It's also important to establish a system for systematic review of scientific research and extraction of evidence for policy change. And we have some very good examples from around the globe. We have the National Academy of Science, which was established in 1863 in the United States. It was one of the very important things that were established in the States, and there are other countries which followed suit. And then establish a system for monitoring and evaluating the impact of existing public health policies and feed the findings into public health policies review and change. And I mentioned some examples of such institutions and systems around the globe. And finally, I would think it would be very helpful to establish a peer-reviewed journal on public health policy, something that will also help the country extract in a regular way and use information related to public health change. I will stop here. I think my time is up, and thank you very much.
Thank you, Dr. Munir, for a very enlightening and informative lecture and emphasis on the very crucial and critical points in public health communication as well as public health deliverance. At this juncture, we will break for the tea, and we'll be back at 9:30. Please be back at 9:30. Thank you so much.